new study finds young people are putting off doctor visits and checkups because it's too costly. Today we're taking a closer look at the risk of foregoing medical care. Welcome back to 10 News at 5, everyone. I'm Beth Haynes. Young people who are just starting out often have to pass on many of life's luxuries in order to make ends meet. A new study finds one area many are cutting corners is medical care. The study done by the Commonwealth Fund finds people between the ages of 19 and 29 tend to skip trips to the doctor, avoid checkups and tests, and pass on having prescriptions filled. The most so was the cost. Young people are often not prepared to pay the high deductibles and co-pays that come with health care. And while 60% of young adults without health insurance say they're cutting back on care, a surprising 40% of those who do have insurance are also avoiding doctor visits and checkups. 36% of those surveyed were already struggling to pay medical bills, and more than 40% have used all their savings to pay off medical debt. More than 30% use credit cards to pay for medical care, and another 30% were struggling to pay student loan debt and tuition because of their medical bills. Well, for more on this topic, we are joined by Dr. Stephen Lorino from Summit Medical Group. We really appreciate you being with us, and you tend to treat patients 17 and older, correct?
Correct.
So let's talk about this study, particularly its findings. What are your thoughts on this?
Well, it is somewhat alarming, but probably not that unexpected. I think the younger patient population in the 20s probably don't think about health care that much. They probably assume that's for older people, and they probably see themselves as invincible. And they're looking at starting families, getting jobs, and they just don't sort of take the time for it.
Does this trend correlate with what you're seeing in your office and what we're seeing here in East Tennessee, young people not taking advantage of those regular checkups?
It does, it does. We've seen a slight decrease across Summit and we as well at Internal Medicine Associates, but yeah, we've definitely seen a decrease. And I think the higher deductibles and co-pays, I think, definitely causes that.
Cost, as we mentioned, was a main reason for foregoing health care. Are there other reasons, though? I mean, I know young people tend to believe they're invincible.
It's hard to say. I just think young people don't think about it. They just don't think about going to the doctor unless they're sick. And, you know, we try to tell them that's an important time to come in, get prevention and screening done. That's kind of what we preach a lot. And it's kind of an investment for when you get older.
Is this a new trend, or is this something we've seen with this generation for many decades?
It's probably not that. It's probably not that new. I look back on times when I was young and going through college and starting my family, and you just don't think about it, unfortunately. What
are the risks? You talk about some of those routine screenings. What are the risks skipping out on these routine medical visits for this generation, that 19 to 29-year-old group? Well,
the biggest is prevention and screening. You want to catch things before they happen. If it's something small, you don't want it to go too long, and you don't want to be stuck in a hospital because you ignored something. I think getting in to talk to your physician, you get a chance to talk about your family medical history and kind of look at what risk factors you have that you need to be paying attention to.
Are you concerned that this may become habit for this generation, 19 to 29-year-olds, and it might continue into their 30s and 40s and 50s?
Absolutely. I think if you don't see yourself going to the doctor much when you're younger, you're like, well, nothing happened then, I'll just keep waiting until something breaks down. And that's not a good way to do it.
We mentioned we're seeing a lot of this people without health insurance, but a huge percentage of young people with health insurance are also foregoing. And you talked about those deductibles and co-pays. Is that pretty much the reason why?
I don't know for sure, but I think so.
Yeah.
We would encourage young folks, especially if you have insurance, till you're 26 on your parents' plans.
Right.
I definitely would take advantage of that. Absolutely.
For sure, and I'm sure that the parents who are supporting those children, because that's with a new law that allows children to stay on their parents' insurance plan until age 26. I'm sure they would appreciate that as well.
Right.
Well, hopefully we'll see more of this generation, 19 to 29-year-olds, taking advantage of medical care. What do you say to encourage them to do so?
I say call your primary care doctor. If you don't have one, give us a call at Internal Medicine Associates. Screening and prevention is what we preach day in and day out, so take advantage. Use this time to take care of yourself, invest in the rest of your life, and show your kids and other family members a good example.
why it may cost a little now, it could cost a whole lot down the road.
Absolutely.
So, thank you so much, Doctor. We appreciate you being with us.
You're welcome. Thank you.
All right.